India is a unique nation which lives in different centuries at the same time. That's something which is a term which appeals to me every now and then in any sphere of activity in our lives as a proud Indian. Healthcare is going to be a dominant problem for the next 2 decades, and in oncology, it's going to be even more dominant, whether we like it or not. Even if we initiate a whole lot of preventive oncology measures to reduce the incidence and prevalence of cancer, things are not going to improve for the next 2 decades, even when we make a very strong, dedicated effort across the length and breadth of this country. So you're going to have a large geriatric population as well, plus a very young country and a young population. And we are going to require a lot of cancer centers, and we are going to require far more skilled personnel, not just doctors and radiation oncologists, medical oncologists, but also radiation machines, medicine physicists, radiation physicists, dedicated nurses. You're going to require a whole lot of teachers and nursing schools in order to be able to face this challenge in some sort of a way. Compared to China, the United States, and even all the other nations, even in the BRICS group, India is still lagging behind in terms of the ratio of patients per doctor. So there is a whole amount of work to be done, and in the challenge lies an opportunity. Now, this opportunity needs to be looked at in a very humane and ethical way, because medicine unfortunately is becoming a business, because that's the reality. You can't take medicine out of the marketplace. Having said that, if you can retain your conscience and your values and your ethics, you will be able to balance by bringing in a socialistic approach and a capitalistic approach together to bring about some sort of a blend which would bring about high quality care, evidence based care, and still care at a reasonable cost. It will always have its ups and downs, and always the challenges of how expensive corporate hospitals are and how cheap the government hospitals are, and is the quality standards being maintained. This is always going to be a fight, a balance, which is not going to be easy to maintain for policymakers. And that's where I see the biggest challenge. And I also see a great opportunity for government and private players to work together to improve healthcare, because health is supposed to be a basic human right.